This is the Berman Method podcast featuring Dr. Jake Berman and physician assistant Jenny Berman. We are here to treat problems and not symptoms. Disclaimer, this podcast is for entertainment purposes only and not to treat anyone or to give medical advice. If you are interested in any information that we are giving and would like to use this for yourself, we recommend that you contact your primary care physician or reach out to us and ask us questions about yourself specifically. Enjoy! Welcome back to the Berman Method podcast. I'm Jenny Berman, physician assistant. I am solo today by myself recording this podcast. So I hope everybody enjoys it, and I hope you're having a wonderful start to the Monday. Even if you wake up an hour late, I hope you're having a wonderful start to your Monday and it turns around if that is something that kind of throws your day off. Hopefully, even if you wake up an hour late, you're waking up with some gratitude that, hey, at least you woke up and at least you have some opportunity to turn the day around. It's a lot mental when it comes to things not going our way or the plans not going how we planned it, life not going the direction that we planned it. We can still have some gratitude. We can still have the mental capacity to turn it around and to say, hey, it's going to be okay. I'm in control and I'm going to turn this around. So here we are on a wonderful Monday. If it's Monday when you're listening to this, if not, hopefully it's a wonderful day, whatever day it is. So I am going to talk a lot about post-workout recovery today, but just to kind of give everybody a background of the Berman Method podcast, if this is your first podcast that you're listening to, normally my husband, Dr. Jake Berman, and I podcast together, and we are all about treating problems and not symptoms. So really trying to identify where problems are coming from, and can we actually treat the problem and not just treat the symptoms to make ourselves feel better? So whether this has to do with back pain, if we are having issues with back pain or leg pain, or maybe we're not even having back pain, but we're having radiating pain down our leg or restless leg syndrome at night where we can't sleep, we don't just want to take a medication for it and try to tell the nerves to relax. Let's actually figure out what's causing the nerves to be irritated in the first place. What's actually causing the back pain in the first place? Is it coming from somewhere else, which 99% of the time it is. It's either coming from the glutes not activating properly or the core not activating properly or something else mechanically occurring that's sending the nerve pain down our legs. Or talking about more functional medicine, which is more my area, and looking at GI issues. So if we're having irritable bowel syndrome or we're having migraines, we're having skin issues, let's actually figure out where the problem is coming from rather than being put on an immunosuppressant and saying, okay, here, take this medication for the rest of your life. Let's actually look at what's going on inside of our body. Is it something that we're eating? Is it a vitamin deficiency? Is it that we're not getting the right nutrients into our body, the right macros, meaning proteins, carbs, fats? So let's actually really look into the problem, treating the problem and not just the symptoms. So that's all about what the Berman Method is about. And with my practice being a functional medicine practice and Jake's practice being a physical therapy practice, we really try to treat the whole body from the inside out. So today we are going to be talking about supplements specifically to be taking post-workout. Now, this doesn't have to be for someone who is only looking to gain lean muscle. It doesn't have to be for someone who is a bodybuilder. It applies to everybody that is moving their body on a daily basis, which should be all of us. We should all be doing some form of formal exercise at least 3 days a week, but trying to push up towards 5 days a week, really moving our body in some sense 5 days a week, even if that 1 or 2 days is taking a recovery walk or a recovery bike ride. We're still activating muscles to do that, and we're still moving. So we need to be treating the muscles properly so that they can recover and that we have limited soreness and that we are actually able to build more lean muscle mass and allow the body to utilize energy to burn fat or sustain fat loss. So, exercising is not just for bulking. It's not just for getting bigger, and it's not just for burning fat. We have to have muscles for longevity. We have to have muscle to support our backs, to support our knees, to support our shoulders and our necks. We have to activate those muscles properly. And if the muscles aren't recovering, we're not going to be able to continue to activate them properly. If the muscles are breaking down, that's where we start to get weaker and we start to have these aches and pains and degrading areas, like where our spine starts to break down, or the neck, the cervical spine starts to break down. And that's what leads us down the road to having to have surgery or hip replacements or shoulder replacements, because the muscles surrounding the joints are weak and not activating appropriately. So providing the right fuel to our muscles goes for everybody, doing all types of different exercises, whether it's therapeutic exercises or strength training exercises. We need to make sure that we are fueling our bodies and our muscles appropriately for the right recovery. So we are going to talk about some of the main supplements. Now, these are not the only supplements, and of course, these aren't for every individual, but the main supplements that are most beneficial to getting into our body for muscle recovery and to make sure that we are continuing to build strong muscle fibers, which in turn can also help with the body burning fat and increasing our metabolism or metabolic rate. So first things first, post-workout and a lot of times even pre-workout, we need to be getting protein. Protein is one of the main building blocks for muscle. We have to get the right energy, the right gas into the muscles to allow the muscles to even start recovering. We need protein as building blocks to these muscle fibers. If we don't have the right protein or gas getting into the muscles are going to break down. The body's actually going to store fat to try to get more energy to allow for the muscles to not break down. The body is very smart and it doesn't want muscles to break down because it knows how necessary they are. So the body will actually store fat to try to reserve energy if we're not providing the right fuel to our muscles. Protein is very, very, very important to providing fuel to the muscles, the gasoline to the muscles, to allow the muscle fibers to rebuild, come back together, and strengthen. It doesn't have to be meat-based proteins. We can do vegan-based proteins. We can do plant-based proteins, but we have to make sure we're getting the right quality of protein. Now, we recommend low saturated fat protein. So if you're looking at a nutrition label, we want to make sure that the protein is 2 times the fat content. So if your protein is 14 grams, we want the fat content ideally to be 7 or less. So the fat is half of what the protein is, or the protein is 2 times what the fat is. And this tells us that it is a leaner protein option. The reason being is that high fat or high saturated fat, which is a bad fat, proteins can cause other issues like an increase of our cholesterol values, an increase of plaque values in our arteries. So we want to make sure that we're focusing on lean proteins. Now, proteins can be a plant-based protein shake. It can be things like tofu or edamame or black bean pasta. It could be chicken, fish, shrimp. It could be ground turkey, pork loin. It could be eggs, chicken sausage, chicken bacon, Greek yogurt, or plant-based yogurt like a Siggi's plant-based yogurt. So we have a lot of options for being able to get protein in. A lot of people will hear about whey protein and casein protein being consumed directly after exercise, and those are good protein options if you do not have a dairy sensitivity or a casein sensitivity. Whey and casein are both dairy-based proteins. So if you know that dairy is bothersome for you, or for a lot of individuals, dairy can cause a little bit more inflammation, we may want to avoid those types of proteins. But we could utilize things like a pea-based protein or a plant-based protein powder, shake, bar to help us with getting some protein in directly after our workout. There's a lot of studies saying you have to get your protein in within 30 minutes of your workout. And, that's great if you can do it, although for a lot of us, it's not realistic. My goal is that all individuals are getting a quality protein option, meaning 30 plus grams of protein within 2 hours after their workout. The closest we can get to 1 hour after the workout, the better. But we want to be getting that protein in at least 2 hours after your workout. Now, the timing of the protein also depends on what time you're working out, how long of a fast you're getting, first thing, from dinner or your last meal the night before to breakfast or the first meal the next morning. So the timing of the protein does differ for all individuals, but ideally we're getting that lean protein source somewhere between 30 minutes to 2 hours right after your workout. So that's really important. I also mentioned sometimes getting protein before a workout is important. And again, this is dependent on what time we're working out, how long that fasting time is between the last meal of the night and first meal of the day. If you're a morning workout person, your body mass, so your size, your amount of muscle mass that you have, the amount of fat mass that you have, your goals, all of this plays into, should we be getting some protein before our workout? And if so, how much? And then again, how much protein should we be getting after the workout? I said, generally speaking, about 30 grams of protein after your workout, but some of us need more than that. Some need 40 grams of protein after your workout. So it really depends on the individual. So protein is one of the most vital things, if not the most vital thing, to workout recovery and muscle recovery. So making sure you're getting the right type and amount of protein in your diet. Moving on to the next one is called branched chain amino acids. So we have what we call 9 essential amino acids in our body. What essential amino acids means is it's the amino acids that our body does not make naturally and that we have to get exogenously, meaning from the outside. We have to get it from our food or supplementation. Branched chain amino acids, there's 3 of them: leucine, isoleucine, and valine. And these are 3 of the 9 essential amino acids. Branched chain amino acids, those 3 specifically though, stimulate the building of protein for muscles to be able to build more muscle fibers and also reduce muscle breakdown. So getting those 3 branched chain amino acids is really, really important in muscle recovery to allow the muscle fibers to regenerate, rebuild, but also to prevent the breakdown of muscle. Remember, as muscle breaks down, our body gets weaker, the joints get more painful. Branched chain amino acids, those 3, leucine, isoleucine, and valine, also reduce fatigue and stimulate our brain function. So they can help us throughout the day with our brain function. They can reduce fatigue post-workout. They help the muscles recover so we are less sore, but also can actually build up and get a little bit stronger. The branched chain amino acids, like I said, have to come from our diet or supplementation. So they are in things like meats, chicken, red meat, venison, ground turkey are going to have these branched chain amino acids. Dairy products and legumes, meaning quinoa, brown rice, sweet potato, are also going to have, lentils are also going to have some of the branched chain amino acids. Of course, with keeping balance of our macronutrients, meaning our proteins, carbs, fats, we want to be careful with the protein to legume ratio, making sure we're getting more protein than really the legumes. Also, if we have a sensitivity to dairy or legumes, we're going to need to make sure we're relying on other sources to be getting these branched chain amino acids. I recommend for myself and for a lot of our clients that are doing adequate exercise or more intense types exercise that they actually supplement with branched chain amino acids, which typically come through a powder form, to make sure that you're getting the proper amount of branched chains either during or after the workout is over. Some people find that they like ones with caffeine in them and take them before their workout, which is okay as long as you're knowing the effects that caffeine has on your body and how much caffeine you're getting in a day. Remember, caffeine can be helpful for the body, but it also is dehydrating. It can also be harmful for those with higher blood pressure or cardiac heart issues. So we need to be aware of that as well. Branched chain amino acids, there's many different ones that you can get on the internet. So tons of different types of powders and supplements of branched chains that you can get on the internet. But you don't just want to buy anything. You want to make sure that it is a quality form, that there's no added ingredients into the branched chains, that you're not getting a powder that has wheat in it, or you're getting a powder with added sugar in it, or that you're getting something that's way too stimulating, too much caffeine. So I would definitely make sure you do your research. If you're going to take a branched chain amino acid powder, maybe ask one of the professionals like one of us here at Berman Health and Wellness if we can help guide you. But that could be a really helpful supplement to helping the muscles to recover. The next one that I highly recommend for many individuals is called L-glutamine. L-glutamine is a natural amino acid, and so our body actually does make it, but a lot of times we need additional supplementation of L-glutamine. It is necessary, glutamine is necessary to be able to maintain muscle protein. So again, that building block to muscle recovery. Glutamine promotes muscle recovery, and it also promotes cell growth and gut health. So we actually use L-glutamine a lot in our practice for gut health, for regenerating the intestinal lining, to helping with preventing leaky gut or gut permeability. Because it helps with cellular growth and muscle recovery, we have to think of the intestines as a muscle also. So it actually helps with regenerating our intestinal lining. But besides that, it helps with overall muscle growth, muscle recovery, and preventing muscle breakdown. So a lot of times our clients will need additional glutamine, whether they are treating their gut health or working for fat loss and muscle recovery or muscle toning. Well, there are, again, lots of different options for taking glutamine over the counter, but I would be very careful as to what type of supplement you get. We carry Pure Encapsulations brand in our office, which comes in a powder and a capsule form. So that's the one that we typically recommend for most of our clients and individuals. Magnesium is another supplement that is vital to the muscles. So this is really helpful for preventing muscle cramping, preventing dehydration of the muscles. It actually helps with keeping bowels regulated, helps with decreasing migraines, helps with menstrual cycles for us women, but it helps with sleep. It relaxes our brain, which is nice. So magnesium is really helpful across the board, but with talking more specifically to the muscles, it actually reduces something called lactic acid. So after we do a workout, lactic acid is what builds up in our muscles and makes us sore. The more lactic acid we have in the muscles, the more sore we are. Movement, so continuing to move the body and utilizing those muscles, will actually decrease the amount of lactic acid we build up, but magnesium actually can also help with reducing the amount of lactic acid that builds up. So magnesium can help with reducing muscle tightness and soreness. It improves the recovery time of our muscles because it's reducing that amount of lactic acid. As I mentioned, magnesium is a really important electrolyte that can also help with reducing muscle cramps. So if the muscles are tightening and relaxing less, then they're not going to get us sore that way either. So magnesium is really important. There are, again, lots of different types of magnesium out there, and I would not recommend something like magnesium citrate or magnesium oxide. Magnesium citrate is very potent on the intestinal tract and can cause diarrhea, but also gut lining breakdown. Magnesium oxide is not very well absorbed. So we utilize two forms of magnesium in our office called magnesium glycinate and magnesium taurate. These are very well absorbed forms of magnesium. They actually absorb into our red blood cell efficiently, so they're getting to the brain and to the muscles properly, but they also are less potent on the GI, so they don't cause the abdominal pain or loose stool that we sometimes can get with taking magnesium. It's really important for doctors to look at a red blood cell magnesium rather than a serum magnesium when we're checking the blood level, because we want to make sure that magnesium is actually getting into the red blood cells where it's going to be better utilized and already converted. But unfortunately, that is not a test that is checked by most primary care physicians. So just being aware to find out your true magnesium level, we should really be checking a red blood cell magnesium. We're going to talk about a couple more supplements. Fish oil. Fish oil, most of us know about it. Omega-3, we hear about it to help with improving our cholesterol, which is true. It does. It helps with reducing bad cholesterol. It can help with promoting good cholesterol. Fish oil is, one of those things that's highly recommended. You can find it over the counter regularly. But when it comes to muscle recovery, the reason that we recommend fish oil and the right types of fish oil is because fish oil is actually an anti-inflammatory. So it actually promotes muscle recovery because it enhances sensitivity to protein. So it enhances muscle sensitivity to protein, meaning the muscles are going to respond better to the protein. They're going to absorb more of the protein, which again is the building block to rebuilding those muscle fibers. But it also reduces inflammation. So if there's less inflammation in the muscles, we're going to absorb our nutrients better and we're going to recover easier. So it's going to provide more energy to the muscles and less inflammation to allow for better recovery. So fish oil, like many of the supplements we've already talked about, has benefits across the board for our bodies with reducing inflammation and helping our body to actually synthesize protein a little bit better, reducing our cholesterol values, breaking down fat so we're not absorbing fat, but it also is really important to the muscles. Now, we're going to talk a little bit about the end about how not all of these supplements are best for everyone, but this is one specifically because fish oil is a blood thinner. So we want to be very careful with that if we are having regular procedures or if we're already taking a blood thinner or have a history of bleeding or bleeding disorder, we need to be aware of that. One of the last supplements we're going to talk about is alpha lipoic acid. So alpha lipoic acid is an antioxidant that we make in our body, but also is helpful to get exogenously, meaning from the outside. But alpha lipoic acid actually helps to reduce free radicals, inflammation, and muscular damage. So free radicals will cause an increase of inflammation in our body. So we want to reduce those the best that we can, and alpha lipoic acid can help with that, as can many other things. But they also naturally reduce inflammation and allow with decreasing muscular damage because of less inflammation in the body. Alpha lipoic acid is actually in the multivitamin that we recommend in our practice. So it helps with muscle recovery, but it also helps with decreasing insulin resistance. So what it does, because of the decrease of inflammation, it actually improves insulin sensitivity, meaning our body is releasing less insulin, it has better blood sugar stability, and is utilizing more protein for fuel rather than storing our food as sugar. Alpha lipoic acid, besides the multivitamin, can also be found in things like red meats and organ meats, which again, we have to find that right balance. Having too much of the red meat or organ meats isn't great for our arteries or really the brain to be getting too much of that saturated fat. But when you have the proper balance, it could be helpful for us. But alpha lipoic acid can also be found in vegetables. We've talked a lot on this podcast about the importance of vegetables and fiber, and here's another reason of why they're so important. But things like Brussels sprouts, broccoli, spinach have a lot of alpha lipoic acid in it. So just remember, alpha lipoic acid helps with muscle recovery and reducing inflammation, but it also helps with reducing our overall blood sugar values and getting the body to metabolize food more efficiently, meaning we're burning more fat. So that one's also really, really important. I've talked about a lot of supplements so far, but one thing I haven't talked about at all is hydration. Giving the body the right hydration. 76% of our muscle mass is water. So we have to hydrate our muscles properly to allow for muscle recovery and to build back that muscle mass and to allow for reducing inflammation. We've mentioned numerous times on this podcast how much water or how important water and hydration is overall for metabolism and for muscles and for pain. But it's extremely important to allow for the muscles to recover. A lot of times we're recommending up towards 100 ounces of water a day for our clients, sometimes more than that, pushing towards a gallon. Now, with consuming that much water, we have to make sure we're getting the right electrolyte replacement, meaning sodium, potassium, and magnesium. So it does come with figuring out the right balance for your body specifically, but hydration is one of the most important things we could do for our body as a whole. Protein and hydration. If I had to say, take 2 tips away from this entire podcast, protein and hydration, protein and water are going to be the 2 most important tips, along with the other areas that we talked about. Now, not all of these supplements I've talked about are great for every individual because of certain medications that you're taking, certain cardiac history, heart history, medical history, blood thinners. Some of those things interact with these supplements. So it definitely is something where you should take note of it. You should write it down. You should talk with a medical professional, maybe talking to us, maybe talking to your doctor about it. Some doctors won't know enough about these supplements to be able to recommend them, so they just won't. But maybe you could reach out to us and talk Berman Health and Wellness and talk to us more specifically about your case to see what types of things we're recommending. I mentioned that we use Pure Encapsulations products in our office. So this is a supplement brand that is hypoallergenic, meaning no additives, no gluten, no dairy, no soy, no corn. They're very clean. The ingredients are tested before they leave the warehouse, so we trust them. However, you still have to know what supplements are recommended for you specifically, your body, your goals, with your history, with the medications that you're taking. So I don't recommend just going out and getting on something, picking up anything over the counter. You definitely want to speak with your professional, but these are some of the important vitamins that we can be using post-workout for muscle recovery. Again, this isn't all of them. Depending on our goals, we may need something like B12. We may need something like folate. We may need something like creatine in certain situations. We may need caffeine in certain situations. But these were some of the more basic ones that are really important with getting started and that you should be talking with your provider about. Remember, adequate protein, adequate hydration for your body specifically is really important. Too much protein is a thing. So again, learning what's right for your body. Too much hydration is a thing for some people. So you have to learn what's right for your body. But reach out to a functional medicine provider and ask them. Again, some primary cares may not know about this type of stuff to guide you, but we can. You can reach out to us on social media. You can email Jenny, Jenni, at bermanwellness.com, BERMAN wellness.com. You can reach out on our website, www.bermanpt.com/wellness. Reach out to us and ask us about the questions that you have, and we are happy to help. If you have any comments, questions, concerns, again, reach out. We're happy to hear your feedback on this podcast. So I hope everybody has a fantastic day, rest of their day, rest of their week, and we are looking forward to seeing you next week or talking with you next week, and we will be back together. Ciao for now. Thank you for subscribing on your social media and podcast platforms to the Berman Method. Dr. Jake Berman with Berman Physical Therapy and Jenny Berman, Physician Assistant with Berman Health and Wellness. You can find more information on our website, www.bermanpt.com for physical therapy, bermanpt.com/wellness for the health and wellness. You can also find us on social media, Facebook, Instagram, and on your podcast platform. So be sure to follow us, like us, subscribe to us. And if you would like any further information, definitely visit our website and reach out to us. You may also find our free reports on the websites as well, where you can download this free information for yourself. Have a great day.